facial nerve. Number 7, as Bell's palsy. Sometimes in your clinic or in the hospital there is a Bell's palsy. Sometimes you see there is some problem for cranial nerve. Number 7 cranial nerve. So sometimes anatomical location of cranial nerve, spinal nerve, peripheral nerve. For example, in peripheral nerve, you see medial nerve, ulnar nerve, medial nerve, or the spinal nerve. And sometimes you must know about the conduction velocity, as you remember in classification of nerve fibers. For example, 1A and 1B afferent fibers are myelinated, large diameter. So they have a conduction velocity, they have high conduction velocity. And also sometimes you know that the sensory motor afferent or efferent. Please refer to classification of nerve fiber. Gasser and Erlanger, and also the sensory classification of nerve fiber. Okay? We discussed in the previous sessions. Okay? And this is the different kind. This is unipolar, bipolar, multipolar neurons. And this is a kind of the multipolar neurons. And sometimes some of the neurons has a collateral branch. For example, some of the alpha motor neurons has a collateral branch, and they synapse on for example, Renshaw cells. And as I told you, the Renshaw cells is an inhibitory interneuron. Renshaw cells. Renshaw is the name of a man. Is inhibitory. Renshaw cells. A collateral branch sometimes on the Renshaw cell, and Renshaw cell is inhibitory. If it's inhibitory, what do you think about the neurotransmitter? Which kind of neurotransmitter do you think must secrete from the end of the Renshaw? One, inhibitory. Inhibitory neurotransmitter. Yes, maybe gamma. Gamma aminobutyric acid. And another example is inhibitory. GABA, and GABA is the famous glass. So sometimes you have GABA or glass. GABA or glass. Okay? And also you have the central nervous system, brain, spinal cord, peripheral nervous system, so when we do talk about the peripheral, please remember the roots. Peripheral means roots. And you must know, as I told you, please remember about the plexus lumbar and plexus lumbosacral for peripheral nerves. In physiotherapy clinic, sometimes you have some peripheral nerve injury. Peripheral nerve injury. I will talk about, maybe if I have time, I will talk at the end sessions, maybe next week, about the peripheral nerve injury. A lot of physiotherapy case of your case of peripheral nerve injury, such as medial, ulnar, radial. Okay? So when you want to contact with the subject and contact, you must know anatomy. If you don't know anatomy, please don't touch the patient, because you don't know anything. If you want to touch the patient, you must know anatomy. In that case, you must know physiology. But in that time, you must know anatomy. Medial nerve, where is the medial? Oh, it's between the flexocardialis and this is palmar here. If you don't know, please don't touch the patient. important. Peripheral nerve vaginismus. I will talk about this. And some of your cases in clinical peripheral nerve injuries. For example, rupturing of, for example, radial and it's a wrist. What can you do with this radar? I don't know. Because you don't know anatomy. If you know anatomy, you can touch it. Okay? Very, very important. This is very serious about anatomy and also in future about the surface anatomy. Very, very important. Peripheral nerve is important. Okay? So, please know what is the afferent, what is the efferent, what is the medial nerve, what is the tibial nerve, what is the temporal nerve. And also somatic nervous system is peripheral nerve, and autonomic nervous system. For example, sometimes you have some subjects in the hospital, and this subject has a lot of, for example, high blood pressure. That's high blood pressure is due to sympathetic and parasympathetic. So you must know the sympathy, autonomic nervous system is very important. When you talk about the exercise, you have the muscular contraction, relaxation. As I told you, is important. Contraction also relaxation. If you have a subject in the hospital or in your clinic, sometimes in your private clinic, see the high blood pressure, I cannot breathe. So this is very dangerous. Anytime maybe the subject is dying. So you must know. You must know what are you doing now. If you are in a good center, you must have the other specialists to come and see this patient. So it means that you must know what is the autonomy. Autonomy is sympathetic and parasympathetic. It's very important. Yes. It's sympathetic. It's very important. If you know in the hospital, you aware the supervision, the nurse supervision, what happens for this patient. It means that you must be very aware. Okay? Very aware. This is a patient, this is a human being, and I am responsible for this. Okay? Please respect to your patient. It's very, very important. Very, very serious when you have a patient. It's very important. If you know the academic, if you have a good science, so you can do it. What can we do for this? Okay? So autonomy is very important. High blood pressure, tachycardia. See, the patient is high tachycardia. The heartbeat is increased. It's very serious. It's very dangerous. It's very important. This is autonomic nervous system now. What can we do? We must aware there's some other specialists for monitoring this patient. Maybe I had this experience. Sometimes in the hospital, clinics, they aware me there is a patient with a cardiac, and I said, we see it's a cardiac attack. The patient was on a bed, and the physiotherapy put some electrical stimulation, and the patient has some problem. And then we are aware and they come and refer the patient to the cardiac. And it takes maybe 8 hours to patient. So this, no. Okay? So you must know. And this is the nervous system, spinal cord, so spinal cord, brain, and motor nervous, autonomic, somatic, sympathetic, parasympathetic. And this is an example of the neurons, collateral, okay? And this is a sensory neuron. This is the axon, this is the dendrite, okay? Sends the information. This is the motor. All the time, the motor nerves is such as the multipolar nerves. Multipolar nerves. Okay? Is important. Bipolar, monopolar, and multipolar. This is example of multipolar. This is spinal motor neuron. Alpha motor neuron. Inside the anterior horn cell. Anterior horn cell. The motor neuron comes to your muscles. There is multipolar nerves. Okay? Axons. Look at that. And also spinal motor neuron. This is the myelinated Schwann cells. Schwann cell is one supportive cell of peripheral nervous system to make myelin. Myelin makes more speed, more conduction. And as we see, this is a kind of reflex. Sensory, motor, internal. As we remember, sensory, internal, association neuron, and then the motor. And the muscle effect contraction. Okay? Central nervous system, peripheral nervous system. So, in the hospital, you have a lot of cases. Sometimes, you have brain case is related to central nervous system. You have a spinal cord. You have sometimes a spinal infection. Is the brain. Is a heart. Upper motor neuron lesion. And also, there is some problem for the peripheral. So in the hospitals, you have some cases, as for example, upper motor, lower. Upper motor neuron means brain, means spinal cord. Any problem for the brain, any problem for the spinal cord is upper motor. Any problem for roots are lower. One sign of upper motor neuron lesion, I'll be talking maybe next week about the upper motor, is spasticity. Spasticity, you see, it's very stiff. Most of the time is related to upper motor, such as Berine's, such as spinal cord. But the peripheral motor neuron has shown some weakness, some paralysis. This is low. So, upper motor neuron. So in this case we have spasticity. In this case we have neurogenic atrophy. Okay? Flaccidity. We have two kinds. We have spasticity. Related to upper motor. Means brain, means, and you have flaccidity. Means that related to lower motor. Okay, so spasticity. In your clinic, in the hospital, you must recognize this is peripheral, this is central. It's very important. If you know anatomy, if you know physiology, you can. And then you must know the disease. For example, this is and different disease. Very important. Okay? These are very important. And this is central. As you see, brain, spinal. Brain is spinal cord injury. These are the peripheral. Radiculopathy is a peripheral. Peripheral nerve injury is peripheral. Disc herniation is peripheral. Disc herniation is peripheral. Affects the roots. Okay? It's important. And you see, this is an image of the cortex. You see, we have sometimes motor cortex in the front of central sulcus. We have motor cortex.
Sulcus.
They sense information from motor cortex to the spinal cord, and then from spinal cord to the muscles. When you contract your muscles, some information from the cortex sends information to the spinal and from the spinal cortex. You must know these pathways. It's important. In brainstem, these pathways is strong. In brainstem, okay? So it's very important. If you know anatomy, if you know physiology, you know what happens here in your case.
You can get a better diagnosis for the patient.
Better.
Diagnosis.
Yes.
And the way for treatment, you can know the every nerve and every arm.
Yes, it's very important. For somebody, you must know. I mean, at least you must know. Median, ulnar, radial, musculocutaneous maxillary, femoral, tibial, peroneal, septic. It's for somebody. And you must know the upper and the spinal cord. And when you are in your clinic or in the hospital, and the patient enters to the room, you must know this peripheral or if you look at the, for example, the deformity, if you look at the hand, the feet, you can distinguish this is a peripheral or upper one. Upper one or lower one. Very, very important for physiotherapists. Okay? If you know anatomy, if you know the physiology, you can distinguish. It's very important. And maybe in this sense, you have the frontal lobe. All the time the frontal lobe is responsible for motor. Has motor striatum. And all the time when you talk about the motor, you mean that this one, motor striatum in the frontal. And also the frontal lobe is important for character. The psychologists and psychiatrists are interested in frontal lobe. Why? Because of character. What's the character in Arabic? Character. شخصية. شخصية. How do I? شخصية. Character. Important for psychiatrists. Important for psychologists. They work on the frontal lobe. And also, the motor strips is, this is a hand. And parietal lobe. The sensory strip is on parietal lobe. So, all the sensation or awareness of any sensory afferent action potential, the parietal lobe is responsible. Frontal most of them know. Parietal is for sensory. Okay? Great. And also you have occipital lobe for visual. Occipital lobe for visual. Visual, the center is in occipital lobe here. In occipital here. Okay? And for temporal lobe, is more, all the time is for auditory. Auditory. Hearing. Auditory. And also the cerebellum is related to balance, to equilibrium. Okay? Very important for equilibrium, for balance. Cerebellum is very important. When a subject comes to here, for example, look at me for my working. When the subject comes to your turn and walks, you got to like that. Look at me, my violent face. It means that by looking at us, maybe there is some problem with cerebellum. Very wide base. But a normal one. The base is such. Base of something is such. It's no, but because it has no equilibrium. homunculus, no balance. Cerebellum. It's important. And also the brain stem is the location center of cranial nerve, nucleus, facial nerve, vestibulocochlear nerve, and then different nerves. Okay, is very important. So you must know different. And sometimes you have one terminus as homunculus, literal representation of connected parts of the body, human body, on the surface of the brain. I will show you in the slide. You will find it. For example, hand is very important, especially for occupation. Occupational therapist works on hand, and also in physiotherapy. Hand is occupied more space in comparison with the other parts of the body on the maybe more than 1/3 is related to hand. Face. Look at me. The face and the hand is occupied more space in the cortical in comparison with your foot or with your trunk. Face. What do you think? What's the reason?
Because they have more adamant function needed for everything.
It's very complex, yes.
There's no this type of
Very
movement.
complex, yes. Because of the fine movement. This is the homunculus. Okay? The surface of the postcentral gyrus provides the literal somatosensory. And also we have somatosensory homunculus, we have literal motor homunculus. I will show you in the slide. So if you need a body parts of fine movement, like hand, fingers, and also for facial expression, it's very important.
وجهي تتحرك
Occupy more space in the cortex because it's very fine. Your expression of the face is very important, and your hand, okay, is very important. So more cortical space. I will talk about the L1 today. In comparison with hip, with cortical space. Hip require less cortical space and require a lot of these spaces. Look at here. This figure shows you the homunculus. Look at here. This is about the tongue, pharynx, and intra-abdominal, and this is the face. This is the face. This is the tongue, as you see, and this is the hand, as you see. Nearly half of the cortical space is occupied by hand, face, and also some throat and vocal cords. You see, but the other is for trunk and for foot. Why? Because these sections are designed for fine movement. Fine, it's very important. Fine expression. Okay, this is homunculus. We have homunculus sensory. We have motor. This is the motor, as you see, motor. Homunculus. This is the so the hand also is so this is the stream of here is motor, and this one green one is sensory homunculus. We have motor homunculus. We have so homunculus is the image of different parts of connected parts of the body on the cortex. Okay? So due to this, the hand is very important. The hand and the face is very important. I mean from the point of the motor cortex, or from the cortex, cortical space. It's very, this means that homunculus. Okay? So this is the same. Is motor homunculus, is sensory, as you see. Remember, all the time remember this. these fingers. More space for hand, for face. As you see here, for fingers. But the rest is one, maybe half of the cortical is related and half to the other parts of the body. And also for motor, this is the outcome. Here, this is the sensory strip, this is the motor strip. As you see here, so sensory and motor are not curious. As if you refer to this slide, you see for tongue, for farting, teeth, gums, for mastication. Mastication is very important. For face, for a lot of space. And also for motor. Face, hands is very important. In brain stroke, you see, if there is any brain stroke cortex, you see sometimes the movement of shoulder and sometimes the elbow returns, but sometimes the movement of the hand doesn't return. Look at in the society. Sometimes you see some patient walks such as this circumduction gait, wait a second. This is the shape. Okay? Hemiplegia or hemiplegia, this one, such as this. And they walk, and you see the society. If you look, sometimes this watch and oh, this is a kind of brain stroke. This one. Maybe they have some movement here, but here no. If the injury is severe, if it's not severe, maybe they have some. But they cannot do the fine movement. They cannot. Maybe they cannot write. This is a fine movement. See, it's very important to find. When you write, you have a fine movement. You can write. You can make. But if there is any problem with the brain, you cannot write. Sometimes you cannot, for example, eat. It's very difficult. Is this difficult? I'm not curious, okay? So the somatic motor system is related to three components. We have pyramidal system, and also we have extra pyramidal. I will explain for you, and cerebral system. But today about the pyramidal system. Pyramidal system which is related to pyramid, and I will tell you. So the motor system can be divided into two systems. One system is the pyramidal. When we talk, please remember, if you want to learn more about the physiology, please learn with some examples. Examples helps you to don't forget about that. Okay? For example, in pyramidal system, when you talk about the pyramidal system and you see a brain stroke, please remember the brain stroke patients most of the time affects on the pyramidal system. And I will show you the slide of the pyramid. Consists of pyramidal neurons. These neurons is inside the cerebral cortex. Cerebral cortex means cortical areas. Project to lower motor neuron. What is the lower motor neuron? What do you think about the lower motor neuron? It is in the anterior of spinal. So the cortex sends the information to the spinal cord, and then from the spinal cord to the muscles. Very simple. Cortex. Cortical. Sends the information to the spinal cord, and then from the muscles. Okay? So this cells and this neuron makes a pyramid. I will show you in this slide. cerebral cortex project to lower motor neuron. It means that if I want to write with this pen, some information from my cortex sends information. This information from the pyramidal neuron to the spinal cord, and then to spinal cord to this muscle, and then I can write it. Any action. Now you are normal. You can do, for example, eating, everything, every ADA. What is the ADA? The ADA. ADA. ADA is very important for physiology. ADA, activity daily of activity daily of living. Activity means to write, to eat, and any activity. And also for occupational therapies are very important. ADL, activity daily of living. It needs to mean your routine for a day.
ADL.
Okay? It's very important. Eating, writing, and
Toileting, eating,
shopping,
washing,
and
and so on.
if a person cannot do activity daily of living, ADL, it means that there is some problem in the pyramids. Why? There is some problem. You cannot write, you cannot eat. There is some problem. So ADL is related to the pyramidal system. If you have a good pyramidal system, you can write. Okay? When you steer, listen to me. When you steer the coffee, for example, is silent. If you have no pyramidal, you cannot do this. This is an example. To steer, for example, a cup of coffee or sugar inside the cup of tea or coffee. When you do this, you need that this order comes from cortical pyramidal system. Okay? And in the brain system and the spinal cord to control voluntary movement. This is when you steer. This is control of the voluntary. This is voluntary. If I write, it's voluntary. If you steer, your tea, your coffee is a voluntary. Okay? So it's very important. This is by pyramidal. Pyramidal. In Arabic, ahram. Haram.
Haram.
Impressive. Haram. In Arabic. Iron. It's such a.
Yes.
And also we have extra pyramidal. This some pathways outside the pyramid as extra pyramidal. The other pathways. I will discuss next session about the extra pyramidal. So you must know these two systems: pyramidal, extra pyramidal. Okay? Pyramidal, extra. So look at please be aware about the ADL. When the patient comes to your clinic in the hospital, please evaluate. And one question: can you do, for example, ADL or no? Ask the patient. No, I cannot eat. I cannot catch a cup of coffee, a cup of tea. This is why. You must write in the file of the patient. Okay? The patient comes, for example, because sometimes some of the cases come to some physiotherapy for 6 months. You must write. And at the end, you must
money.
in the first session, he or she cannot do this.
First session.
Now, after 6 months, you can do this, for example. This is the progress. It's very, very important. Physiotherapy is very important. Very important. Okay? And it's very sweet. Very sweet. What's it in Arabic, sweet? Hello. Halbiyat. Such as halbiyat.
حلويات.
So, we have pyramidal, we have extra pyramidal. look at AD. AD is very important, especially for occupational drugs, for hand. Because the occupational works on that. It's very important. Okay, for motor system or for pyramidal system, we have several cortical areas in the initiation of movement, doing any movement, the starting of any movement. We need neuronal activity within I will tell you, supplementary motor area, in premotor area, and also primary motor area. I will tell you which one is M1, which is M2.
Sorry.
It means that if you want to do any activity, you need to activate different parts of pyramidal system, of cortex. We have supplementary motor areas, we have perimotors, we have primary. Primary motor area is like M1. Is M1. M1.
هذا بعد.
Is primary motor area. Perimotor area and supplementary motor area is M2. So, for doing any activity, sometimes you stimulate in the pyramidal tree different parts. One is the primary motor cortex, the other is perimotor cortex, and the other is supplementary motor cortex or motor areas. So, this is for initiation of any movement. I want to lift this pen and to write. Writing is very important, you know. It's very fun. Very fun. In Arabic, we have khayyat.
Yeah.
Tailor. Is khayyat in Arabic? Khayyat is the tailor is very, very important.
Tailoring.
The job is very fun.
No, no.
And also in Quran, we have samur. The samur. Sam is needed.
ليش ما تشغل؟
كلهم معكس.
Samur khayyat.
كل أشياء معكس.
ليش ما تشغل؟ كل شيء.
Needed.
كلهم
Am I right? Sam is needed.
لازم
Sam and
هاي
khayyat.
أسوي معكس
I but in Arabic sometimes we have samur khayyat. Maybe in the other So please remember M1 and M.
Yeah.
M1 is primary
أقول
motor
تحت تشغل واحد مو؟
plus supplementary motor area. Okay? I will show you the slide. So, neural activity in the primary motor cortex or M1 is associated with the initiation of any movement. To start. Initiation of the movement.
To what? To start.
So, the pyramidal neurons within the primary motor cortex project and activate what? Lower motor neuron. What is about lower motor neuron? Maybe it's in brain stem, maybe it's in the spine. For cranial nerves, look at it. For peripheral nerves, they are in the spine. But for cranial nerves, for example, as you know, yes, for face, look at me. All facial expression. This is, if you see, closing the eyes, open the eyes. All the facial expression is related to facial nerve, is a cranial nerve, 7 cranial nerve. The knuckles of these nerves are not in the spinal, it's in the brain. So cranial nerve, the knuckles is in the brain. So I think lower motor in the brain stem or in the spinal. But for shoulder, elbow, finger are in the spinal. Okay? For cranial nerve are in the brain stem, the knuckles. It's very nice. If you refer to neuroanatomy, you will find that. Did you pass the neuroanatomy? No.
I'm gonna take it to the next level. So.
Next level? It's a not. It's sometimes it's complex, but it's a nice. I think.
والله يجلد
No,
راح
no, no,
ينشد.
no, it's very, very. Okay.
No, anatomy is very, 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 very,
Yes,
very
maybe,
dangerous.
maybe no, Dr. Hassan.
Very
said
hard.
this. I don't know. Dr. Hassan said is responsible for.
Dr. Hassan Zadi is very, very, very shaitan rajim.
So, lower motor neuron in the spinal cord is for cranial nerve and also the spinal cord. In the motor neuron in the brain stem is for cranial nerve. Cranial nerve means optic nerve, means trigeminal nerve, means facial nerve, means abducens nerve, means olfactory nerves. Means a different, okay? 12. Please know the name. Maybe in the neuroanatomy they will tell you. These are the names of the. It's very important. CN, cranial. And for spinal, it's related to muscles, to the limbs, to the trunk. Okay? These are the lower motor neuron in a way skeletal muscles. These are the skeletal. This, for example, is skeletal muscles. Controlling contraction of various muscle groups, different muscles, and the movement of body part. For example, movement of arm or swing. Swing is this. But do it. Swing. It's very important.
Yes. It's very.
If I give an order to subject, please swing, and you do this, it means that at this time, the fifth cranial nerve is okay, because it can. If you know you must know the name and also the function. Look at me. Please do this. Please do this. Please press your teeth. This is the mastication. This is the masseter muscles. It's related to fifth. The name is trigeminal nerves. Do this. All. And this is the This is the mastication. Mastication is very important. The patient said, I cannot chew. I have not chewed. So the reason there is some cranial nerve in the brain stem. So the mastication is very important. This is the mastication. Also, these muscles are important for dentists. For dentists. Do you dentists? It's very important. Yes.
Dentist, طبيب أسنان.
So it's very important.
No.
Yes.
And now, corticospinal. What does that mean? This section now. Who knows what is the corticospinal trunk? Cortico means cortex. Spinal is the spinal. Corticospinal means from cortex to the spinal. Corticospinal. So, the pyramidal system is corticospinal trunk. Trunk is a lot of fibers. Trunk. Please remember, in brain stroke, this is I show you. This is the type of walking of the is the same as I simulate for you. This is the walking of hemiplegia. Very nice. Okay. The corticospinal tracts sometimes is destroyed. What's the reason of walking such as this and this? Because there is no corticospinal tract. Destruction. Or maybe there is environment. Okay? So this is pyramidal system. If you see this, please know that this is pyramidal system. Voluntary motor control is actuated with the corticospinal tract. So please remember for brain stroke. This is a good example. Good example of brain stroke. Brain. If you learn with the example, it's very important because it's very difficult to forget it. The example. without the example, maybe you forget. It's very important. If you want to know if you want to learn more, please have a sheet and then on the sheet, please write and please have for example, a shape, a very small shape. Well, this is the, for example, the peripheral nerve. This is the peristernum. This is the posterior. This is synapse. You learn a lot. Okay, on a paper you can do it. Also, in brain, please remember brainstorm and remember hemiplegia, or hemiparesis. In hemiplegia and hemiparesis, corticospinal tract is suffering. Maybe it's severe, maybe it's not severe. It's mild. Okay? Which travels between the pyramids of the medulla. Medulla is a part of brainstem. Brainstem has three parts: medulla, pons, and midbrain. Three parts of different brainstem. Brainstem is very important.
Yes.
Okay? So, the corticospinal from the cortex areas or cortical area comes to the medulla, and on the medulla they extend, cross. From this section comes here, go to the other, and from this section goes to the other. If the patient has this bucking, it means that the left hemisphere has some problem. If the patient do this, it means that the right hemisphere has some problem. So the right hemisphere is responsible for the right side, or for the left. The left hemisphere is responsible for the right side. You must distinguish when the patient comes to your clinic. Okay? So travel between the pyramids of the medulla. In the medulla is a part of the brainstem and is right known as the pyramidal system. The tract originates in the primary motor area. And also lateral perimotor areas of the cortex as well. And also the supplementary. As I told you, supplementary motor area, perimotor area as M2, and primary motor cortex as M1. It's very important. Okay? So they do this, the lateral corticospinal tract. I will show you maybe the next session tomorrow. We have not done after tomorrow. We will show. I will show you the lateral corticospinal tract in the spinal. We have two kinds of corticospinal. One is the lateral. I will show you on the slide, and one is the anterior. Anterior corticospinal and lateral corticospinal. So the corticospinal tract are the pyramidal system. Okay? Pyramidal system. So please remember brainstem, hemiplegia. When one side, one upper lip, one lower lip is involved, is hemiplegia, hemiparesis. When two lower limbs are paralyzed, is paraplegia. Paraplegia means two. In the spinal, only in the spine. What if it's only one side, one upper limb and the same lower limb is related to the other? If it's paralyzed with two, most of the time is spinal. When the patient comes to your clinic, you must say, no, this is the spinal and this is the... An experienced physiotherapist can distinguish, this is related to the brain. This is related to the spinal. Okay? It's very important. If you know anatomy, if you know physiology, if you know the disease, you can distinguish. It's not very difficult. It's very, very simple. Okay? Mm-hmm. It is a little experience. Okay, so we have lateral corticospinal, I will show you, and we have anterior corticospinal tract. Okay? Look at here. This is the cerebral cortex. And this is corticospinal. This is the first order neuron. This is the first order neuron. Comes, this is the medulla, a part of the rest. Then the quiescent cross. Right side is the left side. Left side is the right side. This is the corticospinal tract, okay? As you see, please track and follow the roots. From the cortex, go to this other side. If there is any stroke, any hemorrhage, any tumor on the brain, on the left, right side, on the left side, the right side is if the tumor is on the left side, on the right side is left side. This is very important. I think it's very, very important. Okay? So, this is the first order neuron. Maybe I will show you the second order neuron and third order neuron because this slide is not complete. I cannot show. It's not here, maybe here. And this is the corticospinal neuron. As you see, what is this? Homunculus. A lot of cortical space is occupied with face and with hands. Very important because homunculus are motor areas of cerebral cortex. Look at here. Sends the information. Cross in this section. And then go to the lateral cord. This is the lateral. If you look at here, the spinal cord, this section, as you see, this section is lateral cord. Due to this lateral cord is the lateral corticospinal tract. Lateral, because the corticospinal tract terminates on the lateral cord. Look at here. If this is the spinal cord, okay? If this is the spinal cord, it's a section of spine, and this is the, for example, the cranium. This section is lateral. Lateral. And the corticospinal comes to this section, is lateral cord. So we say that lateral corticospinal tract. In brain stroke, the lateral corticospinal tract, also there is some problem. Here is the lateral. And as you see, is the corticospinal tract. The site of the pulsation of hierarchies means crushing. It's very important. Okay. So this is the different level which the corticospinal tract travels up to the surface. So corticospinal means cortex to the spine. Connection between the cortex and the spine. Okay? This is very important. If you know the origin and if you know the destination, you say that, okay, this pathway is corticospinal. It's not very difficult to memorize. Cortex to spine, corticospinal. Okay? You must know origin and you must know destination. Mabda, maqsad. You have in Arabic, mabda, maqsad. Yeah, mabda in the same? Mabda. Okay. Origin and destination. Also for muscle, you must know origin and insertion. It's very important. Origin and insertion. Okay. So remember, this is the anterior cord, this is the lateral cord, this is the lateral cord, this is the posterior cord. Okay. So this is very important. If there is any problem for brain stroke, for corticospinal, you see the face and the hands in the patient has a lot of problems. And if you look at these are the corticospinal tract, and in different parts of the spinal cord. Okay? And this is, and at the end, they go on the side. This is an example of sine. So cortical spinal tract, pyramidal system. And look at here, the pyramidal system is a direct system. It's from here, okay? To the, and make a pyramid, and then they could say, you can see they could say here. And this one as anterior, they could say, this is the anterior corticospine, and this is the lateral. In the medulla, they could say crosses on the other parts of the corticospine. And this is the lateral one. So we say that lateral corticospinal. Lateral cortical, because of the lateral cord of the spine. Okay? And also, and then from here there is an interneuron, and this interneuron associated with the alpha motor neuron. So cortex connected to spinal cord by an interneuron. So this is the first order neuron. This interneuron is second order neuron, and the neuron inside the spinal cord here is third order neuron. Sometimes sending of the information and action potential from the cortex to the muscle is by three neurons. First order neuron, second order neuron, and third order neuron. Okay? So this is the pyramidal system. So involve the pyramidal with fine, discrete, and precise voluntary control of movement. And fibers from the cortex descend, means nozuli. Descend means nozuli. Ascend means uli in Arabic. Okay? To the spinal cord, where they synapse on the anterior horn motor neurons. As I told you previously, we have two kinds of motor neuron. Alpha, alpha motor neuron and gamma. What do you think? The alpha motor neuron innervates, maybe the question is such as this. The alpha motor neuron innervates which kind of this muscle? Intrafusal or extrafusal? Yes. Very nice. Extrafusal muscle. Another question. What do you think? The gamma motor neuron innervates extrafusal or intrafusal? Very nice. Intrafusal. So you must know extrafusal muscle fiber, you must know intrafusal. And you must know the innervation. Another question. What do you think? From the intrafusal muscle fibers, which kind of sensory sends information to the spine? Well, now, after 1A, 1AB, or 1A group 2 from muscle spindles.
1A.
As you remember, yesterday, 1AB is from Golgi tendon, was from muscle spindle. 1A and group 2. What about the Golgi tendon organ? 1A. Okay. Have a good discussion now from this up to here. Okay. It's very good. Have a discussion up to here. Okay. And we will continue.